Welcome, ladies and gentlemen. Please have your seats. Bismillahirrahmanirrahim. Yang Muhammad Puan Anfal Sari, the member of Selangor State Executive Council for Women's Development and Social Welfare. Yang berbahagia Profesor Dato' Dr. Muhammad Azmi Omar, the President and CEO of INCEIF University. Yang Professor Dr. Marja Muhammad, the Deputy President of Research of INCEIF University. Members of the INCEIF Management Committee, our esteemed panelists for our event today, distinguished lecturers, researchers, faculty members, students, respected colleagues, ladies and gentlemen joining us here at INCEIF University campus, as well as those joining us live online. Assalamualaikum warahmatullahi wabarakatuh. A very warm welcome, selamat datang, ahlan wa sahlan wa marhaban bikum to the latest ID at INCEIF series entitled Valuing the Unseen, Islamic Finance for the Care Economy, Compassion and Community Resilience. Allow me to introduce myself. My name is Aizuddin and I am delighted to be your MC for today. For your information, the ID at INCEIF series is the latest out of many talks and forums held this year alone as part of INCEIF's vision to be a thought leader in Islamic finance education. Before we begin today, allow me to ask for the blessings of Allah through the following dua. Bismillahirrahmanirrahim. In the name of Allah, the most compassionate, the most merciful. Praise be to Allah, the Lord of the worlds, the most compassionate, the most merciful, the Master of the Day of Judgment. Let your blessings and your peace be upon your servant and your messenger Muhammad sallallahu alaihi wasallam and on his family and his companions. Ya Allah, on this beautiful day, in this gathering of ilm, we raise our hands to pray gratefully and to thank you for your infinite favor upon us. Ya Allah, we ask for your blessings to make this occasion a success. And Ya Allah, there is no mercy like your mercy and you are the Lord of the universe. We ask for your knowledge which is beneficial, sustenance which is good, good deeds which are accepted. Ya Allah, forgive our sins, have mercy upon us, guide us, accept our ibadah, grant us good health, increase our ilm, and strengthen our iman. Ameen, Allahumma ameen. First off, ladies and gentlemen, to give the opening remarks of our event today, I would like to invite to the rostrum Yang Berbahagia Professor Dato' Dr. Muhammad Azmi Omar, the President and CEO of INCEIF University, for the opening remarks. Over to you, sir.
Bismillahirrahmanirrahim. Yang berhormat Puan Anfal Sari, Selangor State Expo Women Development and Social Welfare, Marja, President of Research, Maya, faculty members, staff of the universities, guests, students, ladies and gentlemen. Assalamualaikum warahmatullahi wabarakatuh. First, let me thank everyone for coming to this half-day event, a very important event on the discussion on the caring society. I took the liberty to look at some of the statistics on the age and aging population, because I belong to that. Under the age society, not age. So if we look at the statistics, in Malaysia, 11.6% of the population above 60 and above. But for 65 and above, which I belong to that category, is about 7.7% of the Malaysian population. Of course, within ASEAN, Malaysia is number 4. The first one is Singapore, which is about 20%. Thailand, 15%. Vietnam, about 9%. Malaysia is about 7.7%. Correct me if I'm wrong, I think it's about more than 500,000 age 65. More than 500,000. But I think this is 2020. Come to now. Higher. So I think the challenge that we face today is how do we address this? And I talk also from some friends who are above 65 who are really facing difficulties in terms of, people who work anymore. So the question is, how do we look at Islamic finance and Islamic social finance? How can we combine Islamic finance, Islamic social finance, and be part of the solution rather than be part, can it be part of the solution? So I think today's discussion is how we can utilize, how we can use Islamic social finance, zakat, waqf, salah, then even the Islamic commercial finance, can we use all those finance to be part of the solutions to address this issue? We have the solution. Well, no. But I think the area of zakat, waqf will address a number of issues to be articulated. I think this is one of the opportunity for us to really discuss. And even before we came to this one, we had a good discussion on a number of things in Islam and the initiative. So on our part, itself in the university, established by Bank Negara, not only to look at Islamic finance, but also Islamic social finance, to look at Malaysians as well as international. We will continue to work together with Islamic government. We pledge that we stand ready to support the initiative. We the university under Bank Negara, we should provide that solution. So we promise that yes, the call for action is to support development of not only the context of zakat, waqf, and be a model, also a model to other countries in the OIC. As some of you may know, yesterday and day before we have GIF. Always problem of pronunciation, GIF 2025. And we have this important 40 countries, participants from 40 countries came to the event. So it's an opportunity for us to really show the kids Malaysia's experience in Islamic finance and Islamic social. So we hope with Ramadan support, we will be able to continue together with some and to be showcased in Malaysia and subsequently. Thank you.
Thank you. Thank you very much, Dato, for your opening remarks. Ladies and gentlemen, just to add on to Dato's note on GIF or GIF, this event today is also actually part of the side events, one of the few side events as part of GIF/GIF 2025 that is held currently in Sasana. So I've seen a few familiar faces who were here who was there past today. So it's very good to see you here in INCEIF, and thank you for joining us. Ladies and gentlemen, up next to give the keynote address for our event today, please welcome to the podium the member of Selangor State Executive Council for Women's Development and Social Welfare, Yang Berhormat Puan Anfal Saad.
Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Salam Malaysia Madani, salam Selangor Maju Bersama. Honorable Said and also Dr. Marjan and Dr. Maya, and distinguished guests, respected scholars and friends. It is an honor to be here at INCEIF among those shaping not only the instruments of Islamic finance but its spirit. Our theme today, Valuing the Unseen, reminds us that Islam calls us to see value not just in wealth but in well-being, not only in purpose, not only in profits but in purpose. The unseen are the hands that care, the shoulders that carry, the hearts that nurture, the caregivers, the parents, the community volunteers. They are the foundation of our moral and economic fabrics. Too often, people see Islam as a religion of rituals and rules, something that personal and private. But Islam is more than that. Islam is a way of life, a system of justice, a system of compassion and collective responsibility. It offers solutions to our modern challenges, inequality, aging, care burdens, and loneliness. When we say Islam is the solution, Al-Islam wal Hal, we must show it by turning faith into functions and values into systems. This is where Islamic finance plays its role as a practical bridge between belief and societal well-being. Ladies and gentlemen, behind every productive worker, there is someone providing care. A mother who sacrifices her career, a daughter tending to her elderly father, a neighbor checking in on a sick friend. These acts don't appear in GDP, but without them, no economy would survive. And in Islam, these unseen efforts are not forgotten, they are worshipped. As the Prophet ﷺ said, "Khairun nas anfa'uhum linnas." The best of people are those who are beneficial to others. Therefore, a robust economic ecosystem is needed to support and finance these best of people, the caregivers, to ensure the sustainability and quality of care. And that is where the need for Islamic financing comes in, and Islamic social financing. Ladies and gentlemen, Islamic finance is not merely about compliance, it is about conscience. It is built upon maqasid al-Sharia, the high objectives of preserving life, intellect, family, dignity, and wealth. For centuries, instruments like zakat, waqf, sadaqah, and qard hasan created the world's first social protection systems. They made sure that wealth circulated, that the vulnerable were cared for, and that prosperity was shared. We are avoiding kaila dulatan bainal aghniya'i minkum. We don't want that wealth circulated among the few. The principle of takaful, mutual protection, reflects that we now call community resilience. When one person suffers, others step in. That is Islam in action. Ladies and gentlemen, if you want care to be sustainable, it cannot rely on charity alone. It must be recognized as an economy with financing, governance, and innovation. A care economy transforms compassion from a one-off act into a system of value creation. It generates jobs, strengthens families, and boosts productivity. In the same way, why Islamic finance built halal industries grounded in ethics, we must now build a care economy grounded in rahmah or mercy, where compassion fuels resilience and kindness drives growth. Through the recent Selangor International Care Summit, we discussed the potential of waqf as a sustainable care financing model. We thank Prof. Dr. Syed Marwan, who also part of our guest panelists, and we in Selangor are considering to venture into this social waqf. Historically, waqf funded mosques, schools, and hospitals. Today, waqf can fund childcare centers, elder care homes, rehabilitation facilities, and caregiver training institutes. When professionally managed, waqf assets can generate perpetual returns, just as the waqf of Osman ibn Affan radiallahu anhu continues to benefit the Ummah more than 1,400 years later. In the same spirit, institutions such as Perbadanan Waqf Selangor can create enduring sources of care financing. Through these perpetual returns, we can ensure continuous support for community care, building a sustainable form of social infrastructure grounded in faith and foresight. That is Islam as a solution, turning timeless principles into modern systems of care. And ladies and gentlemen, Malaysia's demographic shift, like what mentioned by Dato', toward an aging population and rising dependency ratios demands innovative financing. In Selangor, we developed the Selangor Care Economy Policy 2024 to 2030 to position care as both a moral obligation and economic pillar. I'd like to extend my heartfelt gratitude to Dr. Haniza here, also part of our consultant in developing this Selangor Care Economy Policy. We took a year, and Alhamdulillah, starting end of 2023, and we managed to launch it in end of 2024. And since it's being used to be showcased at the international level, I was given opportunity to showcase it at a roundtable discussion in UN Women platform in Asia Pacific, in Bangkok, in Nepal, and also South Korea. So our next step is to integrate Islamic social finance instruments to build a sustainable and faith-driven care ecosystem. This is Islam as policy. This is Islam as solution. Under the Madani, as well as the Selangor state government, we believe that Rahmah is simply not a sentiment. It is a principle of governance. The Quran tells us the Prophet ﷺ was sent as Rahmatan lil Alameen, a mercy to all creation. We aim to build a Rahmah-based economy, one that upholds compassion as its core principle, ensuring that no one is left behind. It values the caregiver as much as the entrepreneur, the elderly as much as the youth, and we invest in care. We invest in justice. We build societies that are not only richer, but fairer. That is how Islamic's economic vision turns worship into welfare. True resilience does not come from wealth alone, but from balance, from valuing what the market ignores, the unpaid, the caregivers, and the community. And when compassion becomes policy and policy becomes economy, we move closer to the prophetic model of mercy and justice. So let us finance compassion, invest in care, and make the unseen visible. Thank you. Wabillahi taufiq wal hidayah. Assalamualaikum warahmatullahi wabarakatuh.
Warahmatullahi wabarakatuh. Thank you very much, YB Anfal, for that insightful and impactful keynote address. Now, I would like to invite our President and CEO, Professor Emeritus Dr. Muhammad Azmi Omar, to present a token of appreciation to YB Anfal on behalf of INCEIF Universe. Thank you very much, YB Anfal and Dato Azmi. Ladies and gentlemen, we would once again like to express our heartfelt appreciation to YB Anfal for her insightful keynote address. She will be now taking her leave due to prior commitments and programs. We would thank her sincerely for joining us today and sharing her invaluable perspectives. Please join us in giving her one more round of applause. Can we have one group photo with have everyone please stand up. Thank you very much, everyone. Let's give a few moments for our Dr. Maya to return. She is our moderator for today. Baik, Dr. Maya, you forgot. Right, ladies and gentlemen, on to our panel session for today. As mentioned in the beginning, the topic today is on Islamic finance for the care economy, compassion and community resilience. Our engaging panelists for today are, firstly, Dr. Haniza Khalid, the visiting researcher at the visiting research fellow at the Center of Excellence for Research and Innovation of Islamic Economics, IRISE, at ISRA Institute. Ms. Hawati Abdul Hamid, the Senior Manager for Social Policy Research Section, Policy and Strategy Department of the Employees Provident Fund Malaysia, EPF. Associate Professor Dr. Said Marwan Mujahid Said Azman from the IUM Institute of Islamic Banking and Finance, also a proud INCEIF alumni. And our moderator for today will be the Director of the Research Management Center of ISRA Institute, Associate Professor Dr. Maya Puspa Rahman. Before I let Dr. Maya take over, for this panel session, we will have for about 1 hour or one hour plus, and then we will open the floor for Q&A. For those of you who are in the lounge today, please wait for the microphone to be handed to you for the benefit of our online viewers. And for our online viewers, please do submit your questions in the Q&A window below, and we will try our best to have them all answered in the due time, inshallah. And as a small note, please don't be afraid to ask only the hard questions for our panelists today. With that, I would like to invite our panelists and our moderator onto the stage. And Dr. Maya, over to you.
Dr. Marwan is the only guy. Okay, Bismillahirrahmanirrahim. Alhamdulillah Rabbil Alamin, wassalatu wassalamu ala asyrafil anbiya'i wal mursalin wa ala alihi wa sahbihi ajma'in. Rabbi shrah li sadri wa yassir li amri wahlul 'uqdatam min lisani yafqahu qawli. Rabbi zidna ilman nafi'a warzuqna fahma. Assalamualaikum warahmatullahi wabarakatuh. Very good morning. Alhamdulillah. Praise be to Allah that with this blessing we are able to be here. Alhamdulillah. My personal utmost appreciation for the welcoming remarks by the CEO and also by the Anfal keynote speech, which basically lays a very solid foundation for our topic today. Yeah. I'm also honored to be moderating this session, sitting with our experts, yeah, specifically in the care economy, yeah, and also in their own respective field, right? So, as an introduction, I think we've heard from Dr. CEO with regard to some statistics on aging society, yeah, in particular in Malaysia, and also how Islamic social finance, yeah, or Islamic finance would basically contribute towards the sustainability of care economy. But before that, maybe we'll step a little bit back, yeah, looking into people's understanding on care economy itself. But when we talk about care economy, it is the services that is extended to specific groups, yeah, of people, particularly the elderly, we call warga emas, yeah, the children of our future, the people with special needs, yeah, the gems of our society, and also those who are in need of a specific hospital care. So these are those that basically comprising, yeah, services to this care economy sector. So maybe for the first round, yeah, I'd like to extend the question to Dr. Haniza. How should the care economy specifically be defined in the Malaysian context? And what is the true value in supporting national development, social well-being, and
has been there for a very long time. Yeah, in development circles, care economy is actually a response to gender inequality, right? The issue of unpaid care. So that has been spoken about amongst the LGBT, among NGOs, development circles. ILO talks about marriage because it involves migrant workers. So that's where their interest is. Yeah, the condition of the care workers are usually quite poor, and because it involves migrant workers, so it has become an ILO area of interest. WHO's areas of interest in care comes from because care is an extension of healthcare. So they talk about healthcare and what happens after the patient leaves home, what happens to patients who are at home, disabled and so on. But we have to go deeper even before the 1948 Universal Declaration of Human Rights. Health is one of the elements of standard of living. The right for a decent standard of living is that you have to be healthy. And being healthy means you are cared for. So now, of course, we have SDGs, we have discussions on Makassar now becoming more clearer and more explicit in terms of care. We also have, beginning 2023, the first time UN has declared an International Day for Care Support. Okay, which is in 29th of June. So you will see a lot more events happening at that time. So why now the general term is more care economy. I think the good thing of using the word economy, the bad thing of using the word economy is that how dare you commoditize something that is as sacred as care. When I spoke about this issue, people were really not nice to me because they thought, you are trying to commercialize, make money. They are already squeezing the blood out of people who need care or sick and so on and all and so on. And you are now giving a stamp of economic approval to them. But actually not, because unless we move away from looking at care as a closed door affair, what you do to your family, how you juggle your mak is your business. How you juggle your son is your business. Even if it means abuse and neglect and insufficient or unprofessional level of care, it's still not right. Right? So commoditizing, we are not here to commoditize care, but we are just saying that if you look at it, we have to move from the concept of it being a private matter. Don't ask me how I juggle my work. Don't, sensitive. We are very sensitive. Moving from that and moving from the concept of welfare. Care is not charity. And many of the discussions we have to start with understanding that care is a right. All right? It's a right. And what kind of care you right is your rights about? The right type of care at the right time, not too early, not too late, not after you don't need it, and at the right pace. That's the concept of right to care. And it is enshrined already in many of the human rights. Of course, it's enshrined in our Makassar Sharia. Okay? So when we look at it differently, the concept through the lens of rights, it's no longer a private affair. Just because she's your mother or she's your child, you don't have right to neglect and abuse her and not give her the best type of. And you cannot pass this off as charity also. Okay? Everyone must be responsible. So it goes back to the distribution of care responsibilities between in the family. So the husband and the wife must redistribute because care is a responsibility for all. So redistributing care responsibility from the wife to the husband, from the family to the community, and also from the public sector, from the government to the private sector. They want our work. They want us to come to work on time. 9 o'clock, lalu kat jalan yang tak boleh lalu tu. Kan? But they don't care how we have to care for our children and our parents. Okay? So this is the premise that I want to say. Why care is such an important thing. It's not orang baik-baik je worry about care economy. Everyone should worry about care economy. Right? Okay, now we look at the market side because it's more like economic. So why do we call it economics? Simply because whenever you have something that has demand, right? Demand yang Dr. Michael kita lah, from the elderly, from the persons with disability, PWDs, from the children, from patients, yeah, who are transferred back home, and so on. People who had accidents and then person post-surgery, palliative care and so on. So these are the demand side of care. Alright? Now who supplies care? Mostly in Malaysia, supply of care is family members and women, female family members. So you talked about unpaid care. And then government. Government ni usually rumah kesedi kenangan. That's your vision, right? That's what you or NGO, Darul Hanan, that kind of institutes. And then where's the private sector? Well, private sector is at the end of the spectrum, very expensive, very elite, more expensive than 7-8 star hotels. And then you have them, a bit of it. An extreme supply model, which is very expensive, and you have another extreme supply model which is totally unpaid or unregulated, untrained, no standard, and then no backup support if anything happens to the caregiver. So you have this very extreme and very little in the middle. And at the end, you don't have choices because you don't want this, yet you don't want that. So even like middle income people are a bit desperate for good options. Yeah. I have sent my sister to many rumah penjagaan. Those rumah penjagaan, that actually let me enter and see where my sister is living and how's the toilet. Many rumah penjagaan, because they are not ruled as hospitals, they are not regulated as hospitals, they don't allow you to come in. And they can do that. And you sign the agreement as such, you are transacting with them. So whatever you sign, you have to agree. So that is just one example of what we don't know what they do. So that's care economy, how it benefits people in terms of peace of mind. You will never be at peace until you find a good care solution for the person that you want. Whether it's children, and that allows you to become all the engineers, all the doctors, the economists that you are, is because of that peace of mind. You won't even leave house if you don't have that peace of mind. Right? So that's why care is so linked, not just to the people who are being cared and to the caregiver, but to also to the rest of us. Okay. Now there are some researchers who make studies. INCEIF, for example, they valued they took the number of people or who are not working and most likely to be doing unpaid caregiving jobs at home. Either they resign or they do not want to work because of unpaid care work at home. And if that is valued as services sector in the GDP, one of the sub-sectors under the national account, under the services, that could be equivalent to 1/5 of the services sector. And services is already a bigger sector in our national accounts, in our GDP, right? So imagine the unpaid care, anything related to care could be 1/5 or even more of the services sector. If you take labor force participation rate, we spoke that ours is only 58%, 59%, we aspire to have like 60 or maybe 80. If you convert the women who are not in the labor force, women who are not in the labor force, not even unemployed, and if they just don't want to work, they're not looking for work, right? So if you take women who are not in the labor force, and many of them are especially education certificates, if you take them and then add those who work part-time or gig economy, informal economy, most likely also caregiving responsibilities, you could raise the labor force participation rate to at least 80+%. And the amount of the month of production or national income that this group can create is 70+ billion. The national income creation from this group is converted into full-time FTE. Okay. Under one study using input and output analysis, if we take the care economy sectors with their current multiplier and impact on the economy, we add 5% investment into care-related sectors, 19 of them. We could create job creations up to 1.3 million. We could create GDP increase by 6%. The numbers are there to show that care-related is also an economic activity with strong backward and forward linkages. And it affects everyone, not just from the piece of my side, but it really has created the supply chain. We really can have a good supply chain related. So investing in care is not just for the social and religious reasons, but it's also due to the economic value. And with Malaysia, Thailand has made care tourism subsector. Right? If you go to Chiang Mai, there are many resorts that have been converted into an international care facility. And people go there from Germany, from UK, especially. They need it. They get money out of that. I'm not saying that we should do that, but at least we should widen the options. But in demand and supply, any market, if you expand the supply pipeline, you'll be able to drive price down, increase options, and create innovations. Right? As market people, we know that will happen. But we need to have very strong regulation backing up this sector, of course. Right? So I think I'll stop there and
thank you so much for a very insightful description. Yeah, that is just introduction. Yes, well, I like the concept when you talk about commoditizing the care economy, because these are the values that are still unseen, but yet it is valuable. Yeah, like what you have mentioned about the women labor force, those who need to quit work just to take care of their mothers, just to take care of their children and whatnot. And we, in fact, we also did a research specifically in terms of the childcare, right? The sustainability of the operators, even. Because we as a mother, when we want to go to work and put our 100 or even 200% into our work, we have to have that kind of peace of mind. So we need to know that our children are being good taken care of. Yeah, we don't want to be facing the situation whereby we send our children in one place and then suddenly the place has to close down because there's no sustainability. They can't actually afford in terms of the operations and whatnot. So I think with that, I need to basically hear from our Madam Hawati. Yeah, she's the Senior Manager, Social Policy Research Section in INCEIF. What then would be the key policy instrument, perhaps a digital framework, governance mechanism shaping the care economy in Malaysia? And how do you think would this align with the global best practices in promoting inclusive and sustainable care system?
Okay, thank you, Dr. Maya. Assalamualaikum warahmatullahi wabarakatuh. Thank you to INCEIF for inviting me to be part of this conversation. Congratulations for picking up on this very important topic, which I think we should continuously in this committee to prime this issue so that we get a lot more policy traction and attention. So, and also thank you to Dr. Haniza, because she has basically put up or outlined the overview or the boundaries of care that we are going to discuss today. Because as the topic mentioned here is valuing the unseen, and when it comes to care, when I was doing this work related to care, there are a lot of things that are moving parts, meaning that how we define the boundaries of care continue to be shaped by what changes that is happening in the society, and that's why it is important for us to try to take a broad view of this care economy before we narrow down to a more specifics of the gaps, underlying gaps in this non-targeted policy. So maybe if I can just share a bit, as mentioned by Dr. Haniza just now, care can have a lot of spectrum actually, but the two major spectrum that we typically look at is one hand is related to education, nurturing, and care, nurturing, especially for children. On the other hand is more related to healthcare, which a lot of the time in these two extreme segments, a lot of it have been making a lot of progress in terms of how the work has been professionalized, how the system and standard have been in place. But even between these two broad spectrum that I said that have been mainstream, there are certain segments within the paid care ecosystem that is still facing deficit of work. For example, those who are providing paid care in the domestic setting continue to be underpaid. They face deficit in decent work. For example, they work long hours. They are not given adequate social protection. So these are the points that we have to bear in mind while we are trying to navigate further to expand or deepen the outreach of the policy in this paid care economy. On the other side of the coin is another spectrum of having this unpaid care that continue to be shouldered by the women especially, and those who have to step out from the real thing or the thing that they really want to do, and basically sometimes they have to forego some opportunity that they can reap just to provide, to extend the care to those who are needed. So it is really important for us to recognize that while care has been is usually taken private as a private matters, but we need to recognize that care is the one actually sustain the mainstream economic activity, and that's why we should not take care as a periphery, but it should be integrated in all policy that we are developing. So maybe if just to come back to Dr. Maya question just now, what has been the policy frameworks? I think in the past there have been patches of policy talk about the relevancy of care economy, but a lot of the time it is related to women empowerment. Why the reason why we want to value this care economy, because we want to unleash the potential of women to come to get a lot more active in the labor market. These especially have been when I track the policy, it has been started in the appearing in the conversation since around K4, for example. But there have been a bit of a period where these discussions have been not discussed so much, only until recently in Rancangan Malaysia ke-12, where we recognize the urgent needs for us to really address the issue of critique aging in Malaysia, and that's where conversation in the policy making have started to also marry the issue related to women empowerment, as well as addressing the needs of long aging society. And that's where if we can see even from Madani economy framework, there have been a lot of emphasis on how we should be valuing. I think there are 5 things that we need to recognize within this care economy. First thing, we need to recognize that it is existed, and how do we reward those who are doing the work. And the other one, trying to, as mentioned by Dr. Haniza just now, how do we redistribute the care responsibility not only within the members of the family. Just now she mentioned about redistributing the care burden shouldered by the women, for example, when the men should also take parts in the direct and indirect care that happen at the household level. But at the same time, looking at a broader changes in the society, for example, like how our society is, how our family is shrinking, whereby we can no longer continuously depend on just expecting caregiving to be extended by the children or for the women, for example. And that's where we need to find a model that try to also provide additional support to the family. This is where the importance that should come from the market that she mentioned just now. How do we create, or how we create a affordable and varied types of services that can cater for the care needs of the household, so that part of it can be procured from the market, and while the rest like women can also play their role in the economic activity. But another thing that I think we need to also consider is the unpaid care. This is the most notorious types of care that we need to see. We really need to try to value these types of activity, and this is where I believe that a lot more work, especially in terms of valuing the unpaid care work. For example, here I have done a bit of a study to using time use survey to value the work, the care work that is taken place at the household level, and to put a value. And this is something that at the national level we need to continuously have a framework to value unpaid care work, so that they can be appropriately compensated lah. So but maybe if I can just add to that, I think another area that also require serious consideration when we want to expand or deepen further our care economy is in terms of regulation. And maybe if I can highlight 3 key regulations that in place that I find that maybe can be harmonized and strengthened, because without a good standard and regulation, it will be hard for the private sector, for example, to come into the space to really drive the activity. For example, like investment fund like EPF also, without a good regulation and standards, it will be hard for us to really put adequate investment because of the high risk in the investment. So I see that a strong regulation could somehow de-risk some of the risk that market need to take, and providing a conducive setting for the market player to invest in this care economy will provide a lot more impetus for a lot more supply to come in lah, and in a more varying spectrum. So at least right now we have three Act. First one is Act 506. This is under Kementerian Wanita that governs the running of all types of care centers. But there are still lack of standard and procedure that, and also inefficiency in terms of getting the approval to get market players to come into the market quickly. And this is where strengthening the standards for the infrastructure, for the talent, and for the workforce need to be strengthened on that space. The other one is Act 586 that regulate the Private Healthcare Facilities and Services Act. So this is important on the other side of the coin, where we are talking about healthcare provision that are a lot to do with medical related. But one point, the other act is Act 802, that is Private Age Healthcare and Facility Services Act, which have been approved by the Parliament but has not been enforced because of the lack of regulatory capacity of the Ministry of Health to enforce this. So what happened is that a lot of the time, aged care player who would like to come to the market, but they are not really have the intention to provide the medical specific types of care, but still they are governed under Act 56, which sometimes can be a lot more costly for them to abide for the rules. So we need to find a way to harmonize and try to demarcate what are the acts that really related to a lot more a lot more focus on medical care that require a lot more supervision and regulation. But the other side is really to provide a bit more space for the private sector to provide just a social care. Because, for example, for aged care, we have to recognize that there are a lot of spectrums of care needed by our elders. Some, they are really totally dependent, meaning they are already can't really do their own daily activity by their own, and some of them are really in needs of medical care. So that is okay for a lot more tighter regulation to be put in place on the care provider. But there are a lot of other elderly care that doesn't require a lot of medical needs all the time, but they still need continuous attention, and because of an inadequacy of supply that can come in at the right time and at the right price. That's where there is a bit of bottleneck for us to really extend these types of care to a lot more households who need this at affordable price. So I think that's one of the things that I would like to highlight.
Thank you, Madam Hawati. I think you have rightfully pointed it out, particularly if we want to look in terms of the affordability of some assistive technology to be used for aging in place. In fact, there's also a very big gap with regards to the supply and the demand perspective. And I think hopefully now with the more advocacy here, in fact, from Selangor's perspective, being the first state to introduce the state economy policy, the concerted effort should be there. the what you have mentioned, the patches, yeah, of the regulatories and whatnot. Some belong to another agency or ministry, yeah, and then some segment basically is answerable by another agencies. That's basically create efforts that are not pretty much concerted. I think I just like to also extend when Madam Hawati mentioned with regards to the unpaid work that is basically being the responsibility of women. Yeah, I think YB Anfal in the previous Selangor International Care Summit also mentioned about 80% of this unpaid care work is basically held by women, yeah, or falls upon the shoulder of the woman. So this is where when women, if they don't have option, they have to fall out of the workforce. Or even if they do still continue working, they still need to take care of themselves because it's contributing to the mental health, having to work, having to take care of the family, to take care of your elderly. Yeah, because I also have, Alhamdulillah, my mother who is now 74 years old, also a diabetic patient, need special care and whatnot. Yeah, so those are the things that we have to, the value that are still unseen. Yeah. So maybe I'll extend the question still on introductory. This is still around, first round, yeah. To our learned Associate Professor Dr. Said Marwan. Maybe you can, I know your aspiration and your interest has always been on the Islamic civilization, yeah, on how this, what do you call it, embody the care historically, the compassion, social responsibility. So maybe you want to comment on that, and perhaps on also how, in what ways the Maqasid Sharia, yeah, particularly the preservation of life, wealth, or even intellect, yeah, serve as a guiding framework to developing the policies that are related to care economy.
Thank you very much, Dr. Maya. Thank you also for to the organizers for organizing such a meaningful topic for us to discuss and highlight. Going to the question, basically, when we talk about the Islamic civilization and the principles that it has brought, and how does this apply? How do we apply this to care? Right? I think we have to go back to, go back even before the introduction towards the fundamental question of why are we here, right? So this is a very philosophical question, right? What is our purpose? Why are we here, right? So when we look at this question, we have to go back to our Islamic worldview, right? So the Islamic worldview is that if we look at the Sharia, we look at the Quran, Allah has mentioned why we are here. So there are two aspects. Firstly, Allah mentions, Inni ja'ilun fil ardi khalifa. So our role, firstly, is as a khalifa, right? And this is translated into English as a vicegerent, right? So this is a very traditional English word, whereby the vicegerent is a representative of the king, right? So you have the king and he has his dominions, and the king appoints the vicegerents to take care of certain areas of that dominion. And what's also important is that this vicegerent, he takes care of that area, not through his own will, but he follows the will of the king, right? So we as a Khalifa, Allah has put us here. It's not taking care of this world according to our will, but we have to follow the will of Allah, right? And the second aspect, why we are here, Allah mentions is إذ قال ربك للملائكة إني جاعل في الأرض خليفة وما خلقت الجن والإنس إلا ليعبدون. So we have also the role as an abd. Right? So an abd is a servant or a slave, right? So the servant or the slave, he acts in a way that not through his own will, but acts in a way that tries to please the master. He follows the master, right? So we as human beings have to follow the master of masters, right? Allah subhanahu wa ta'ala. And how do we do this? We do this by following the Sharia, right? So the Sharia is, of course, by looking at the Quran and the Sunnah, the practices and the sayings of the Prophet. And we then, the scholars then interpret this Sharia into the fundamental aspects or the principles, which we call the maqasid, right? And this is where we look into the I think the often quoted is the Rudiatul Khams, right? The five essentials that we have to preserve, right? So this is our role as a Khalifa in Am. Essentially, we have to fulfill the maqasid. We have to fulfill the preservation of the essentials. We must ensure that the essentials that we need for a dignified life in this world is taken care of, right? So this is where we go back to the issue of care, right? And Islam also not only provides the theoretical guidance, but also provides the practical tools, right? And these tools nowadays is called the Islamic social finance, right? And unfortunately, before we go to fortunately, unfortunately, the role of Islamic finance, Islamic social finance has diminished somewhat. I believe post-colonialism, right? The role of waqf, the role of zakat and takaful hisbah as institutions that really provided care was diminished. And when we started to look back at developing a more sustainable or financial and economic system that is based on Islam, early on, I think we focused more on the commercial aspect of Islamic finance, the banking, like the more capitalistic aspect of Islamic finance. But I'm glad to see nowadays we see the increasing interest, the resurgence of people interested to look back at our heritage, our Islamic heritage, the heritage of Waqaf, the heritage of Takaful, Zakat. And these are the tools that Islam has provided, right? And I think before, because we are talking about the unseen, before Islamic social finance was less valued, I think, less valued. We were focusing more on Islamic banking, right? But now, alhamdulillah, we are talking about it now. So we are seeing the value of Islamic social finance, and I hope we can continue to develop it further because nowadays people are talking about sustainability, SDG, all these impact, but actually we were the leaders. The Islamic civilization were the leaders of this, right? In terms of sustainability, but unfortunately we did not champion it in this modern era, right? When we talk about SDG, it's already, when you look at maqasid, it's already there, right? So we have to, I think another aspect of valuing the unseen is we have to value our Islamic heritage, right? And these tools, when we talk about the application, basically you can apply these tools into three main layers, right? So the first layer of social protection, right, is provided through the institution of zakat, right? So this is where the zakat provides the immediate relief for the people who really need it, the 8 asnaf, right? For the people to, you give immediate cash transfer, immediate. So this is basically to fulfill their essential needs, right? Essential needs, the daruriyat, you can say, right? And secondly, you have the second layer is where the waqaf comes into play, right? And the waqaf is supposed to support, right? It's supposed to support the daruriyat and also the hajiyat and tahsiniyat, right? Whereby if we look at the seerah of the Prophet, the waqaf was, you look at the gardens of Khaybar, which provided the food and the shelter for vulnerable people, and then you look at the well of Rumah, whereby the well was being bought from the Jews, and then it was given to be utilized freely for the benefit of the community until today. And basically, the Sahaba developed the concept of waqaf further until we saw, or many, when you go through the literature, some would say the golden age of waqaf during the time of the Khilafah, and also we see in especially during the Ottoman Empire, right? The institution of waqaf was the main provider for care in terms of hospitals, in terms of schools, in terms of education. This institution was the one that provided the foundation for care, right? Not the governments, right? And then after colonization, I think this role and post-colonization, when the British and all the colonizers left, but they also left us with a new form of governance where this role is taken over by the government, right? Providing healthcare, providing education. When in the past it was provided mainly by the waqf, right? So maybe this is something that we have to explore again and empower again the potential for waqf. And I'd like to also highlight a bit when we look at, because I was reading through how waqf was being applied during the Ottoman Empire. And yes, they provided hospitals, they provided schools, but they also provided care for animals, right? So there's, I think until today, right? So when we talk about care, maybe it's not only care for human beings, but also care for beyond humans, animals, and also the environment, right? So and this is again going back to our fundamental reason of existence, and the Prophet talked about rahmatan lil alamin, not rahmatan lil muslimin, not rahmatan lil insan, but alamin, right? So maybe the discussion will be a lot more, but we can expand the concept of care to also look into the care of the animals and also the environment as well, right? And then the third layer is where the tool that Islam has provided is when you have emergencies, right? And this is the tool of takaful, right? And the tool of takaful, where during the time of the Prophet, there was the concept of aliyah, and also you can see in the Madinah Charter, where you have the concept of tabarru and mutual cooperation. No matter you're Muslim or non-Muslim, you will cooperate if there is a need to pull the funds together. Basically, the state or the people in the state will cooperate and come together to help. So this is the concept of takaful, and basically it can cover basically Muslims and non-Muslims, and these three layers basically you can say is the way that it is developed is a bit different in the economy, right? Because you have the economy, you have the private sector, the public sector, and these layers, these three tools, you can say is the third sector. And the way that the supply is provided is a bit different, the way it is considered. Because when we talk about the economy, you have the supply and demand, and the supply usually would have the consideration of what is the return, what is the financial return, what is the risk, right? So here the supply of these tools have a different consideration. It doesn't look into the financial returns. It doesn't look into what is the risk if we invest in this, right? So you have to have a different perspective when providing these kinds of care from the Islamic social finance perspective, because the returns that they look at is the social returns, right? It's not the financial returns, right? And this is maybe the returns is the multiplier actually may be higher in terms of the social returns, right? And then there's another additional aspect that you can say is a more modern innovation, which is the fourth layer. Which is the blended finance, right? So the first three layers just now is the more traditional, but now I think we have this space and the frameworks are there to develop innovation where we blend the Islamic finance with the Islamic social finance. And this is where we have in Malaysia we have developed the SRI sukuk framework, right? And then we also have the SRI linked sukuk framework, right? And you have basically the framework is already there to issue the waqf sukuk, right? So you can blend the Islamic capital market with the waqf, but I'm not sure now. Now we have not yet issued a waqf sukuk, but there is the conversation that is going on. I think from the government as well, and hopefully it can be implemented. I believe we can unlock the potential, especially for waqf. When I was searching in terms of the potential, I saw the speech from I think the chairman of SC. He mentioned the potential of waqf that has not yet been unlocked in Malaysia is valued at 1.3 trillion. 1.3 trillion million, right? So there is that potential there, whereby waqf can be empowered to contribute to care as well, and we also have the potential to blend Islamic social finance together, where waqf and zakat can maybe come together to have to form a takaful, right? To form a takaful, now we are talking about long-term care takaful, especially for the elderly, because now you have insurance and takaful, but they don't cover after you're 60, they don't cover anymore because the risk is too high, right? So if we look at the different consideration from the third sector perspective, we have that different consideration. We don't look at the risk, we look at the social returns. And so these are some ideas that I wish to introduce first, because I have not yet touched on the maqasid. Maybe in the next part I will touch on the maqasid. Thank you very much.
Okay, subhanallah, mashallah. He said he just wanted to do a small introduction and bring us back to the history and whatnot, but he has basically advanced on the financing models and whatnot. But I think I really like how you reminded us with regards to why we are here, the role of the Khalifa, and also what we have basically extended, particularly on the care economy, is something that may not have financial return. Yeah, I like the concept when you use the social return and whatnot. But if we were to look back again on this particular care economy, we need to also look at the financing part. Yeah, this is where it becomes much interesting. I think some of the concept has been touched by Dr. Said Marwan on the not 3 but 4 layers. So maybe later you can provide some examples. Yeah, just for the benefit of the participants, we also have several research that are related to the care economy, which is funded by our Islamic Economy Research Fund, Research Innovation Fund. And Dr. Marwan is also looking and researching, particularly Islamic social finance and the aging society. We also have dedicated focus on the children and also the assistive technology as well. So this research, one has been completed and some is still ongoing. But let me also go to the interesting part, of today, the financing part, which is the most critical part when we talk about care economy. Who should be financing it? Yeah, should we only rely only to the government? Should there be a helping hands from the public sector, from the NGOs, or even the public? Yeah, so maybe Dr. Haniza, you may share with us your observation to the financing of the care economy, the various financial models, and the cost and also implications.
Thank you. So this is round 2. Okay, now we'll talk. I think this is where you are most interested in how do we finance. Firstly, may I ask, how much do you think you need to fund your care?
How much do you think?
If it is a child with special needs, if it is an elderly with special needs, dementia, or loss of limb because of amputation, diabetes, and so on, they have NCD issue. How much do you think you need to save for cost? I think that will be also answered by Puan Hawati. But funding care has been something we have always taken for granted. We always assume that our family members will pick it up. I have 5 children, someone will pick it up. All right? Someone will share the burden. And the best solution now is go and hire a maid. As if the maid is also a caregiver. But people get that confused because The right way to define the job care is again looking at the type of care that's needed, especially when we have different types of disabilities and different type of loss of functionalities. There are several types of disability. The maid can't possibly, you can't have a general maid coming to take care of different types of disability and also aged care. So no one, it's a contingency, we call it in Takaful, in insurance, it's a contingency, and yet we do not know how much we should have to save, how we are going to plan our care when we go home. Young people like you, when you have a child, are you already planning how to care for your child? And how much you want to put aside money for them? So this is where we go back to the concept of supply and demand. You need to have more supply because demand is definitely there, and there is really no specific quantitative way to know how much care. You can have pension planning, and that is supposed to help with care, and we also, but we need a contingency in the nature of 10%. This one. Let's say we look at welfare department. Or welfare provisions. Our country is not a welfare. The underlying basis of governance is not welfare economics. Yeah, but we have, for example, Department of Welfare Services. If we just look at the number of beds in the Rumah Seri Kedangan, in the Pusat Elderly Care Center, how many beds are there, and how many millions of elderly people above 65 do we have? You said just now 7.7%. Right now is 8%, and that's about close to 6 million. Every decade, every 10 years from now on, we are adding 2 more million. Okay, and the beds with the Department of Social Welfare is still 1,000. Okay. So clearly, welfare is not doing good, and they can only take people who are homeless, who are destitute, who doesn't have anyone else to take care of it. So that's why the market option, when we say the market supply, we are not saying that everything must be paid through the nose. We didn't mention the price, right? And we didn't mention who's going to pay them for that. So the price, as well as who is going to subsidize, whether it is provided free of charge, discounted, subsidization, cost price, profit price, that will be something else. But we are saying that there must be enough supply to meet the demand. That allows us to have the right care at the right time and at the right place. Right? So there's a don't villainize. Don't say that, because we didn't mention price. This is where the role of the government to come in. Yang free tadi yang 1,000 bits plus. Those are government subsidized, and you have cross subsidized. What does it cost? There are so many pricing strategies. We want to make sure that nobody is discriminated on account of their ability not to be. So that's why the rule of care must be without causing hardship. Otherwise, it's not right. Yeah, it must be without causing hardship. Okay, so let's say option family is one, and family is struggling. Option 2 is welfare, and we talked about the capacity, right? And Dr. Marwa, I will leave it to Dr. Marwa to talk about the third sector, okay, to really dive into third sector. Now, let's talk about government. Because government, how can they expand at 1,000 bed? Okay? So Malaysia, we know our health system is fully subsidized. So RM means you are fully subsidized. If you go to the hospital, confirm that it is fully subsidized because we have a UHC coverage, universal health coverage. And in the RMK 13, how much is the budget for health? It is about 9.9% of the federal budget. Okay, between last year and this year, the increase is about 2.8%. Now, and still we find it insufficient. Still we find it horribly insufficient. Looking at the if you compare the population growth, if you compare the growth of elderly you cannot increase just 2.8. It doesn't jump. Yeah, you need to increase, and if you compare the cost of maintenance, 0.8 is like in the senior citizens, jive with the rest of the trends. Okay, so that is universal health coverage. There is no such thing as universal coverage. Stay in the hospital, but they won't cover care outside once you leave the hospital. That's why we even have this phenomenon that's called social hospitalization. Because if you put your mother in the hospital, you can claim. Right? But if you care for your mother at home, you can't claim anything from the insurance, or you even have social hospitalization in public hospitals. Today, CNY or whatever, Hari Raya, people will send the mother has been diarrhea for so many days, please have a look. You take her when she's okay, we're going to take her when discharged. And they took 3 extra days to get her out of the hospital. Or apparently they've gone off holiday or they've had something hospital. That's social hospitalization, and it's not only in Malaysia. It's everywhere. Nurses know this. Okay? So because of that imbalance, you have a fully subsidized health system, but you don't have a fully subsidized or any kind of subsidized options for care. And it makes our hospital even more burden. Right? Because there are certain things that if you had given proper care before, you do not need to go to hospital. You can prevent so many falls and injuries if there is good care at home. And you just need to go to clinics or without going to the hospital to burden the current already stretched health system. Okay, so that's why people are now talking about should we have some kind of social protection as far as care is concerned. Yeah. I would also want to touch about insurance, if you want to know. So let's say before we go off the taxation issue, we are not to say disappointed to because as I said, the 2.8% to compared to the other trends in the health system. Yeah, if you see the ratio of doctor to patients for now is becoming less. And government knows that, and they put the targets less. That's worrying. But just to say that, so can we just increase taxation? Is that the solution? Increase taxation. So that because the government kata they don't have money, or you can put a tax more. Let's look at direct tax, for example, which many countries in the European, in the Northern Europe model, the tax system is beautiful, everybody is admiring because their tax system is high, right? Some brackets are up to 40%. Okay. But in Malaysia, our tax bracket is low, but the worst thing is that the number of people who can pay tax is even low. The mean, you remember median? Remember, I will do for the median for you. Remember median? Median is like 50% of the distribution is earning less than that number, right? Our median income is for each wage earner. This is not from the HIN, this is from the labor force survey. Our median income is 2,700. That means this is 50% of our people are earning 2,700. About 30% of them is earning around the minimum wage. So how many people in the working population who are earning, working population group, that's what you're earning. Half of them are not earning, or they are in precarious or informal or in gig work, right? So those who are earning income, how many percent of them are now paying tax? And which bracket are they paying at? So we are quite at the dead end in that sense. Okay? So to aspire, you need to work somewhere else. So it has to be either Islamic Finance alternatives instruments, that sector, or even a real profit sector. When I said this is a business that you can, right? Those who cannot pay the price must be supported, but the business must get their cost and whatever profit that maintains their sustainability. They can talk about social return, but they will not stay if they cannot cover their costs. Someone must come in to cover it. Just like we are paying for our oil, no one will supply us oil at a certain rate that we think is ideal. Someone is actually paying for us behind our back. Because we have to have that ecosystem where this can be facilitated. But these people who we are bringing into the market, who want to invest in the market, must get their incentive, must get their sustainability promise. Otherwise, they won't stay in the market. Okay, so whether through financing, through subsidization, through and so on. So let's look at, since we already talked about Takampo, so let's look at Takampo model. And also the insurance model. Both models, either you want to use the Singapore whole insurance or you want to use Japan, mixed method insurance, whichever method you're using. And even the taxation model of the northern European countries and Canada and so on. They are now facing constraints or limitations because the cost of health, the cost of care is increasing. You know, medical inflation is cost of care is also increasing. There's not enough people who want to work in care. So the cost of labor is increasing. The infrastructure is also costly. Okay, this is not FMB. You know, you're caring for people 24/7, or you're caring like you have even learning disability. There's specialized care that needs to be provided, right? So these are costs to train, to maintain, and so on. So cost of health, the use of technology in care, in diagnostic, in monitoring, also this technology is also becoming more expensive if there is not enough supply. So the cost is escalating and all the countries are aware of this. But Japan is thinking that, 40 years old, we have to start earlier. So 20 years old, we can start saving already. Singapore is also struggling with how can government compensate the insurance company, because insurance companies who pay for the care at the end of the day, they're not the government, right? Insurance people still have the private sector yang supply the care. Okay, but paid by the government, paid through premium and with government on the government's care. The insurance people, they cannot handle the cost, they cannot absorb people, they will reduce the eligibility requirements, they will require higher co-payments, they will put all the grace period, blah, 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 and all that sort of stuff. Remember the case of the insurance guy who got shot? Because people were annoyed, they asked for insurance so long. I mean, this is an extreme case, but it is something that we need to safeguard our long-term care system. Whether you go by the tax method or you go by the long-term method, the Takafo method, insurance LTCI. So they are good, but they have their limits also. So what do? We need to find a few more options because nothing is a silver bullet to everything. So you have to find all the third sector options. You have to find, in terms of tax, look at the indirect tax options. That's what people are calling for, bringing back VAT because your income is being stuck. Your income tax will not stuck as a tool. So people are talking about, should we consider VAT? Should we consider other options? Because even one cannot cover the needs, the massive amount of demand for care. And even the rich people do not know how much care they will have to allocate, cost of care. So not one solution. So listening to more solutions, and maybe those solutions apply best to different people or different groups of people, So this is where, so having a discussion itself is a right step. But don't be too limited in saying that one is the best over another. You will not. This is where we have with UHC, universal coverage. One is never enough for everything. And as a middle income country, we are aging. People age as rich countries. We age as a poor country. People Japan, Denmark have aged at a very high income level. We are aging at a poor income level, general. And the speed of our aging, that we become so high, the percentage of aging is 4 times, 3 times faster than how they aged, how fast they aged. So everyone is clamoring for a solution. So we are welcome, listen, but we have to consider what would work best and who should be deployed. Because what I feel is that everyone coming with a solution and working in silos, right? Don't downgrading the other side, like the other side not be able to face the whole system and that will not be right. I'm thinking, I may sound triggered because I'm not at the end of my career course. So this is my my reminder to everyone, especially young, we have to work with, and we have to talk to each other. Whether it is CPM, whether it is qual, whether it is zakat, really we have to share this burden together. We have to share our weaknesses as well so that we can complement each other. Yeah, let me see right there. But you can ask me in the Q&A later if you want. All age dependency ratio, we all know that all age dependency ratio, meaning how many people, 100 people who are in the working age population between 60 to 65, how many old people can we support? Should we be supporting? We are working, assume that we are working. So this is where the testing come in again. Yeah? So how many, from 100, if there are 100 people in the working age population, their productivity or their income should be able to support how many old people, right? So that's called old age dependency ratio. Okay, so 2005, 100 people is enough to support, but 100 people working can support 7 old people. Okay, now, the class. Okay, all right, okay. In 2024, 100 people will now have to support 11 plus. And remember the working age population, not all of them are working, not all of them are earning stable incomes, and not all of them have income that can pay for other people. They themselves could barely survive. So I'm very happy to see these alternatives and this discussion. Although I sound like so worried, but actually we are having a lot of these options that we are talking about. One of them is what we're doing today.
Thank you, Dr. I think we do have good basis to be worried. Yeah, I may share with you some of the statistics. How many populations of Malaysia that we have now? About 32 million, right? The 32 before. So about 16 million are in the workforce. Out of the 60 million in the workforce, half of it are basically foreigners, right? And in most of the foreign workers are basically a lot in the care sector. I was involved here with one of our research in the training, providing training for the care workers, and out of the 120 participants, those who are being taking the training, only a few, I think it's not even a handful. I met only 1 or 2 that are Malaysians. And even these Malaysians, they are taking care of the VIPs. Yeah. So you can see that the rest of them are basically coming from our neighboring countries. Yeah. Even some of them are coming from the Middle Eastern countries. So this is where it becomes costly even. Yeah, we have to basically compensate because it's not getting cheap like what Dr. Hamiza said. Yeah. If I may also quote some of the feedback from our stakeholders here that are providing the care, I think for elderly houses, the average, I think the minimum one would be 4,000. That is the minimum per month that you, yes, the home modification as well. So it's not something that everyone can afford. So if you look in terms of the dependency ratio earlier that you mentioned, out of the 200, it has 100, 11 has to basically finance for that. Yeah. So 11, we have the 110 basic finance, 11 of the old
Last time we only
workers.
had
7, yes. So it's getting even higher and the cost is even escalating that much. So let us move to Madam Hawati. So when we look at Madam Hawati, it's always about EPF lah, So from your perspective, how prepared the Malaysians are for aging and retirement? What are the gaps that is we need to be, the gaps lie and we need to be aware of? So please.
Thank you, Dr. Maya. So the question is how prepared those are in Malaysia. So I think I'm going to give a very stereotyped answer.
That's our worry.
So I mean definitely preparedness is not even, right? So certain segment of the population having a lot more prepared to embrace aging as an individual, but some are not. Okay, so and then I really like the discussion to do. This one size fits all model does not work. There is no silver bullet in financing aged care or even care. And that's where I like the idea. Maybe Dr. Mawar will later unpack further on blended financing and how different pillars can play the roles in providing adequate support and financing beyond just letting individuals rely on themselves. But then since you are talking about individual preparedness, so I'm going to prime this discussion of my discussion on individual preparedness, especially with regards to retirement adequacy and retirement income, because EPF is one of the key institutions that really try to take care of the preparedness during old age. So in that regards, as mentioned just now, just to add on to Dr. Maya punya concern, the statistic and data is not really pretty lah. Basically, if you look at in terms of the adequacy of retirement income, right now only about 30-something% only of our EPF members have achieved basic income, basic savings to during by age lah, basically, because depending where you are in the age distribution, if you are young, we have some estimation what are the basic level of saving that you need until your retirement age. So when we look at the overall picture of everyone based on age, only about 30% of our members have achieved basic savings. So that's one. These are among those who are part of our members. But we also have a lot of coverage issue whereby about 40% of working age workforce in Malaysia are not even part of EPF members. And if we add those who are outside the workforce, but still within working age population, the percentage would become about 60%. So we have a lot of issue in the concerning coverage for old age income security. One. The other one is in terms of adequacy. So definitely a lot more need to be done to ensure preparedness in terms of at least in terms of income, because I believe that income play a key role, even though we want to say that money cannot solve everything, but money really can provide a lot of solution for those who needs. And if you do not have money, a lot of the time in modern days, you will be at disadvantage. You will not get access to a lot of services and goods and services. So that's why the idea of retirement or having dignified retirement also have evolved even within EPF line of thinking. While we in the past we concerned about how much you will get by the time you retire, but we also want to adopt this life cycle approach to ensure all the contributory factors that contribute to dignified aging or retirement to can be tackled at the root. That's why one of the key initiatives that we did recently is in terms of account restructurings of EPF saving, that even though I know where we introduce another additional account, we call it account flexible. Even though there are some critics say that it is a leakage to the retirement saving, but we believe that you cannot settle you cannot overcome or you cannot address your retirement needs if your current needs is not being addressed. For example, a lot of our members who are working in irregular working work arrangement, like those who are working part-time and just can contribute not regularly, sometimes they need to access to fund when they are facing contingency. For example, like Grab drivers, if one day the tire pecah, for example, then even if you do not have access to emergency fund, basically you are facing income loss, and that's where we feel that there need to be some buffer or access to fund for these types of emergency for people who are in this situation. And based on the data that we are looking internally in terms of the behavior of flexible account withdrawal, we do believe that people have the ability to actually decide what are they really need of to use the fund. Because while when we first introduced the withdrawals facility, memang at the initial phase during the first 4 months, memang there is a spike in terms of the access of withdrawal. But later on, in this last at least 10 months, the withdrawals amount has been stabilized to about like $500 million only. And those who are doing the withdrawal on monthly basis is less than 1%. So meaning that those who are really in need are actually doing the withdrawal. So that's one part in terms of the accumulation. I would like to discuss this in with regard to EPF individual punya preparedness to aging and age care needs into these two segments lah, accumulation and decumulation. So that is one part. Accumulation part is where we need to tackle coverage and adequacy issues. And then and then in terms of adequacy, most of the time I think a lot of the population also tie this adequacy with the low wages of low wage structure in Malaysia, which is not wrong, not totally wrong, because our median age is very low to begin with. But another important thing is actually consistency in terms of contribution. We do a calculation to really see whether people would be able to achieve basic saving or not with minimum wage. Actually, people would be able to achieve basic saving provided there is consistency in terms of contribution. So, but the consistency can be a challenge to those who are not in a formal work employment ataupun full-time jobs, and also disruption in terms of employment, they lose job and things like that. And the other one, because of the care works that people have to take, especially among women, that have to step up from the labor market and take shoulder the burden of care. So these are the underlying causes that actually contribute to the disparity in terms of retirement adequacy. And in order to address this is where initiatives like at least under EPF scheme lah. So we have been able to actually pull in government to be part of the initiative, whereby especially for informal sector workers, kalau informal sector, you have yourself to contribute as well as your employers, but it is not the case for the informal sector. So this is where government have been putting commitment to provide matching grants under INCEIF initiative, and we can actually see positive behavioral effects from this initiative, where last year memang there a spike in terms of contribution from the informal sector workers lah. So that is in terms of accumulation phase. The other side of the coin is the decumulation phase that I feel, and even there is a recognition within the EPF system and social protection system in terms of how there is still gaps ataupun shortfall lah in terms of the decumulation program ataupun facilities that is available for the members, not only for the member but for the public as well, for the general mention. The first one kalau within the EPF system is that satu, the lump sum design of our saving. That is something that we would like to work on and try to improve, because data shows that providing access to lump sum saving at the point of retirement will affect sustainability and sustainability of the saving lah, because after a few years, a lot of the time members will just deplete all the saving, and there is also a lot of scam happening, especially among our elderly at the point of retirement, because that is where people, especially your family or those related to you, tiba-tiba muncul because they know that you are having access to a lot of money. So that's why one way of policy enhancement that we would like to introduce progressively is to see how certain portion of EPF saving will be allowed to be withdraw lump sum, but certain need to be draw down on monthly basis. But definitely benda ni is a hard reform, because the social contracts that we have been that has been understood by kita punya member is that once you are 55, you will be able to access to your savings kan. So there need to be a lot of consensus building and stakeholder engagement in order for us to implement this lah. And even so, kita nak increase the withdrawal age to align with the retirement age, but has been something very challenging for us to do because of the social contract that have been existed for a long time. Members can withdraw their saving at age 55. This age has been set since the existence of EPF, where our life expectancy has been low, and now our life expectancy has increased so much so that this legacy policy, I think, need to evolve at the same time lah. So that's one. The other one, measure about alignment of retirement age. with the withdrawal age and basic income drawdown, and also um, the other things that we are also trying to look at in terms of how annuity products can also come in to also take care of the longevity risk in the event where people outlive their saving lah, the saving that they have. So this is where kalau kita tengok multi-tier pillar of pension, a good pension system dekat Malaysia, we have a tier 0 tu yang is welfare based, which kalau ikut best practice it should be tax funded, but this is only available to a very small segment of population under bantuan warga emas lah. And then kita terus pergi kepada individual account under EPF system. Kita tak ada lack of this tier 1 where ada element of solidarity in terms of pooling the risk of longevity risk and have the gap funding too. And this is where we are trying to look at in terms of blending the financing of tier 1 where the government can come in together with workers or members or individual as well as their employers to be part of the contributor to the fund. And this is where kalau there will be a bit of cross subsidization now, where those who saving who are so happen to live a shorter, then their saving will be used to finance those who are living longer. Those who are having higher income will be by cross subsidizing those who are low income lah. So these are the few reforms that we are looking at, as mentioned, summarized into the accumulation phase and decumulation phase.
Thank you so much, Madam Hawati. I think the key word here is to have a dignified retirement. Yeah, I think the numbers also make us more worried. Yeah, in terms of the sufficiency of the basic savings at 30%. Yeah, and also I think I'd like to basically touch it. It's associated it with the financial behavior. I think even though someone has a very good financial literacy, their own behavior, their own spending, yeah, when you suddenly become not multi-millionaire, but a millionaire or a sukuk millionaire, yeah, when you retire, you might spend it to something that is, not even productive, yeah, buying a car, 250,000 and whatnot. So I also remember our PCO was sharing with us in one of our meetings that he said some of his friends, yeah, who has already retired, becoming B40 because of the management of the wealth, the insufficiency of the management of the wealth and whatnot. So I think let's go to Dr. Marwan, Marwan, perhaps because you have already mentioned the 4 layers earlier. So maybe you can share with us some of the examples, yeah, particularly that we can actually look at, or models that we can actually look at to finance the care economy.
Thank you very much, Dr. Maya. Actually, because in terms of the examples, I like to look at Islamic social finance. It has to be an ecosystem of blended finance within the Islamic social finance itself, whereby you can combine waqf and takaful and also zakat together in this ecosystem that can address different needs in the society for care, right? So some examples that we already have, and I like to highlight the example of Jacob. Right now, we have Jacob basically providing what you call corporate waqf, where a portion of their shares is given as waqf, and the returns from that shares is then used for the care, right? So you have some portions for health, some for education, some for the orphans, right? And there are many examples. But I wish to adjust a bit in terms of the question just now, Dr. Maya, because I already talked about the four layers, the tools. I want to go back to have a different perspective of how we look at care. And this is where I like to highlight the perspective of Maqasidic framework, right? So we look at care, usually look at the issues that already come up with, that are already there, and then we try to address it. But when we address the care from the Maqasidic framework, we have to go back to the fundamental, which is the daruriyat, right? And Islam has already provided that guidance, where the daruriyat is, as Dr. Haniza has already mentioned, this is a right, right? You have the right. The daruriyat for me is the right. You have to ensure that everyone's fundamental, essential aspects are taken care of, right? And maybe just a bit of what you call ulang kaji, right? So that I jotted down some aspects where I think when we look at the daruriyat, even we have the daruriyat and homes, right? How do you then apply this from a policy or instrument perspective, right? So you basically from a policy making, or when you apply the financial tools, the areas that you have to ensure is that you take care of the essential needs of the people, which is the healthcare, which is the shelter, okay, the nutritious foods, and this is the first aspect, which is the hifzun nafs. You take care of the life, right? And everyone has this right, right? And then secondly, hifzuddin, right? You basically also, this is also part of care. You provide an environment where people can practice their religion freely, right, for non-Muslims, but also the accessibility of places of worship, right? So you have to make sure that the places of worship, the masjid, for example, is accessible for OKU, is accessible for orang tua, they want to, maybe they can't drive anymore, they want to walk there. Is it accessible or not? This is also part of the fundamental right, and I believe this is the care perspective from a Maqasid right perspective. And then thirdly, Hifzul Aqal, where we basically provide education and mental health education, mental health services as well, right? This is also another aspect that we have to look into and ensure that it's not only there, but it's also accessible, because a lot of, especially mental health services, I believe is not yet adequately accessible, right? So this is also another aspect. And then fourthly is the hifzun nas, right? The family. So you must ensure that we have family-friendly policy where we have we can support working parents with childcare, right? With accessible and affordable childcare, and also flexible workspaces where family can thrive, because we are talking about aging society, right? And the issue now is that people are having less children, people are marrying later, some even choose not to have children, right? And maybe when they decide to have children, it's already too late, right? So you have to address the root cause. Why is this happening, right? So part of that is looking at the hifzul nafs. And then finally, the hifzul mal, where we create a sustainable economy, where we again reduce inequality, ensure that, I think YB Anfal mentioned, that the wealth does not circulate within the rich, right? So how do we do that, right? So some especially in the West, in their manifesto, is basically one of the manifesto is to tax the rich, right? And I believe our Prime Minister also likes to mention about the Mahakaya, right? So maybe that's one way of yes, it's a sensitive topic, but we have to really look at, especially the people who you know, we know they are rich, right? But somehow they are not paying the tax, right? So this is another aspect, and this is the Daruratul Khams. But there are some scholars that also say that the Hifzul Alam is also part of the Daruriyah, right? So I believe INCEIF has published a book on the taking care of the environment, right? By translation of Yusuf Khattawi. And so this is also another hifz that we have to take care of, right? And this is basically to ensure that the way that we move as a society, the way we move in terms of the economy, ensures that the environment is also taken care of for the future of our children as well. And then I believe as the foundation, Madam Hawati mentioned just now, is about the dignity. We must ensure that the care that we provide, this is another daruriyat we have to look into, which is the health of karamah al-insan. The care that we provide, the services that we provide, is done with dignity. When you provide the cash transfer or the zakat, is done in a way that people feel dignified, right? So I believe this should be the essential guideline when we implement whatever tool that we have. We can utilize the maqasidic perspective, and it is already being looked into by the policymakers. Now we have the maqasid framework from the Securities Commission, whereby they are looking into how we can apply the Islamic capital markets instruments, the sukuk, the bonds, in a way that addresses the maqasid, right? In a way that addresses the maqasid. And this should be the fundamental perspective of how we look at care, right? Another aspect that we maybe neglect, which is also part of the maqasid, because maqasid is maslahah, but also another part of the second part of maqasid is to remove the mafsadah. Because when we talk about care and financing care and the services that we provide, we are just talking about addressing the symptoms. We are addressing the aging, addressing the health, but what is the root cause, right? What is the root cause? To prevent this from, we know this trend is happening. We know we are aging, but what are the policies to, if not stop the aging, at least slow it down, right? So you have to have the policies where people will be comfortable to have more children. Mothers can they don't feel guilty going to work, right? They have the childcare accessibility, right? So this is also part of the whole care ecosystem. And another part is on the healthcare, right? Because actually yesterday I was in Parliament sharing a bit on some issues, and I touched upon the issue of Malaysia as one of the highest diabetic society in the world, right? And the cost of diabetic care only is around 1.4 billion. The cost that we are spending that on our healthcare, and unfortunately, we are also subsidizing sugar, right? So how much are we subsidizing sugar? It's around 400 to 500 billion.
All Malaysian countries.
Yeah. Right. So yes, we are talking about addressing the symptoms, but you also have to address the root cause. So the policy perspective, basically, we know this is a problem, and we know that the financial burden will increase, but the issue is that we are only trying to, how do we find the money, right? But if we try to reduce the cost by addressing the root, I believe this is also another way to look at this topic, and hopefully I believe as Islamic finance practitioners, we can utilize this maqasidic framework to address the care as well.
Yeah, I think in terms of maqasid perspective, you have basically addressed it well, but maybe just a few lines before I open for the Q&A. I suppose there are several participants who would want to ask questions. Based on coming out from your research, there are several models, because I also have to declare interest. I'm also part of the researchers under Dr. Marwan. So we have looked into several models, right? The one model, like whatnot. So from your perspective, which one is going to be much more feasible and easier to be adopted in addressing the financing issues of care economy?
it's not going to be easy. That's right. So the honest answer. But we can do it if there is a will, especially if we look at the potential for waqf, right? 1.3 trillion still unlocked, right? And yeah, so because waqf is basically you are not touching upon the seed, you're not touching upon the principle, and it's basically sustainable. The essence itself is sustainable, right? So you're only looking at the returns, but we have not yet fully developed this waqf.
But the advocacy is not there, and what you said, the political, the will.
Yeah, the political will, and also uh, the management of waqf itself. Because if you look at, for example, the Muhammadiyah model, right? It is sustainable. Or if you look at Harvard, although it's not called waqf, it's endowment. Harvard endowment is around, if I remember, 60 billion, and they can have the way that they invest it, the way that they utilize it, is that I remember during post-COVID a bit, they had a return of 30%. You imagine return of 30% of 60 billion.
Dedicated and separate fund managers.
Yeah, they have professional managers. So maybe we need to have that as well. And the way that the way that they utilize it, they don't utilize the 30%. They only take 5% of the returns. The remaining 25% they put back into the waqf. Right. So this is where I think we have to reflect back, where we are not seeing the value of our Islamic social finance, and we have the potential to utilize it. Yeah.
Thank you, Dr. Mama. So I'm opening up for the questions. We open for the please, mashallah, Dr. Latifa.
Assalamualaikum. My name is Latifa. I'm from Selangor Islamic University. Okay, I would just like to share enough and also like to ask it. My research also on health economics and also on currently Islamic social. Actually, I agree that for every issue we have to look for root cause. But actually, on healthcare, the inflation of the cost, the root cause is the doctors. The root cause actually is the doctors based on my research. For example, why healthcare cost is escalating? For example, because I am currently doing one research where I interviewed the insurance representative and also doctors in the hospital. They are even the patient. Yeah? Then, sometimes the patient have operation, right? But then the doctor insists to do the operation and then the payment with the insurance company is not sufficient. So that when insurance company call the doctor, he will say that do you want the patient to die? But actually that treatment is not necessary. Right? So what happens now is the patient has to pay. So that what the insurance company will do is they will increase the monthly payment. So this is how it escalates the cost of healthcare. That is one reason, right? So the doctors, you cannot ask them anything because they have protection. Yeah, you cannot ask the doctor, you cannot question them. So I think we need enforcement, strong enforcement especially in the private hospital. And interestingly, the healthcare cost is very high in GLC. All these aspects we have to put because the cost will not. The cost will continue increasing if we do not cater the root cause of this issue. So even in terms of values, like elderly, right? So what is the precaution there? In terms of values now, education system. So I also interviewed one of the elderly. So even they send the parents there, but the parents pass away, they don't even come and do the final. So what is happening to them? And then when we go to the public hospital, we pay 100, but we think until next year. For example, if I go to the public hospital, when I register, the appointment is next year. So the poor, out of expenditure, they have to put the price, right? And they take that. So even the middle class, they shrink through the poverty level. So how are we going to resolve all these issues? Because if let's say we have a solution, Islamic finance already, but if the root cause, we do not solve the root cause, the cause, and we still need to find a way out of the issue. This is my point. Thank you.
I suppose it's awareness that's
Awareness.
also associated.
Enforcement also.
Exactly. Thank you, Dr. Latifa. Any questions? Yes, please, sister. Assalamualaikum. I'm Hasanah from Nigeria. So question actually is an addition and maybe sharing development idea. So in the recent budget 2026, there is actually an announcement by the government for cash water sukuk dedicated for special education, autism centers and palliative care facilities. So hopefully it's something that we can look forward on how to progress unfold after the success of the cash water inshallah. So yeah, because we talk and spend a lot discussing about the funding and so on. So it's something that I just would like to share with the audience as well. Thank you so much. So highlighting in terms of the cash one cup that we are yet in terms of financing specifically on the care economy. Do we have any questions on online? Okay, yes, go ahead.
Thanks, Halina from IIN. Thank you so much for the very productive and I think it's a hard time for us to discuss about it. And I like to recall about the title of ID INCEIF. It is actually the methodology that we can measure the value of the social creation. That is what we call it the social return of investment. And the methodology is coming from the Social Value International and also part of the team. And that's one of the report that I would like to share from coming from a short report, the SROI in the Australia. For one center of participant of the treatment center, $1 Australian dollar being invested to that particular center, the value created is about $1.79 Australian dollar. So actually, it could be like one of the measurements that we can do with regard to the social activities. And another example that I would like to call about the zakat. And we know that there are billions of collection of zakat in Malaysia alone. And what we know about the state like Wilayah and Selangor. And taking about example from Sarawak, they have Makin Islam Sarawak created on the Tabung Baitulan. And this is actually that they are not putting into the website anymore. This is something that we got from the research from this Majlis Islam Sarawak. They have put into the fatwa part of money from zakat, they finance into the commercial area, to build the commercial area. Then the proceed for the commercial area, then that is actually the about to give to the beneficiaries to us now. That is actually something that we can see is the zakat also can be used a part of the consumption monthly distribution. That could be a use that to do of the healthcare center, for example, the clinical center or any specific like the Parkinson's and so on. That actually we can explore what the from the research perspective.
Thank you, Dr. Harina, for highlighting in terms of the social return. Yeah, I think you're also a member of that. They call it social value. Okay, right. Thank you for that. Any of the panel would like to address or perhaps contribute more into the discussion?
Assalamualaikum warahmatullahi wabarakatuh. I'm Mariana. Currently, I take mini career break, mini retirement. I think it's the main points are always the same. When you are caretaker, you're going to take care of yourself or your family. I think the beautiful of the Malaysian society or even economy, we have a multiple organization or institution that need to be collaborated in terms of like a SOCSO or EPF or any other things.
thanks to EPF, because I'm currently utilizing my account tree to take a break and plan for what's next to reskill myself. But on the other hand, as a caretaker, this is what I understand, because I'm also a financial advisor. So in a way, a caretaker or housewife or a graduate housewife, sometimes they undervalue themselves. So careers that need to be created as part-time or gig economy need to be coupled with a kind of income-driven or with a salary slip or a so accompanied a solution, so that it can also address the care society of financial resilience. This would be the part that I think it should be taken care by all the ecosystem. Thus, it will benefit the whole society as a whole. Thanks.
Thank you, sister. I think, yeah, in terms of the economic flexibility, it gives us pretty much flexibility in terms of our withdrawals. And with regards to those women, particularly who step out of the labor force, I think World Bank recently issued a report or taking the feedback from the employers for those who have not been working, yeah, and began to basically come back. I think one of the things that they highlighted is that whatever they have been doing, like taking care of the family or the sick mothers or the children or whatnot, should also add value to the CV. Yeah, because you're not doing nothing, you're doing something that is valuable, although it is not seen and valued as in from the financial perspective. Yeah. Yes, Nathan.
I think that ties in very well with the concept of dignified care. A person must be able to receive care that makes that preserves his dignity. Yeah, and but to provide care, a dignified care, requires that the person providing the care also feels that he or she is dignified. At the moment, our caregivers do not feel that they are dignified. You know, the companies that operate care services do not feel that they are being treated professionally, even by not just by the patient, but the families of the patients. And the cost, it's like nobody believes we do what. We talked to some of the operators. Families even ask for the father is bedridden, use Pampers 24 hours. The family kid, why are you using so many Pampers? They even question, that's not dignified care, you know, and then they're not giving dignified care to their mother and their father, and then they are talking to the caregiver as if it's a maid. It's like, this is like a job everybody can. Is that kind? You're not giving dignified funds. You're not respecting the cost of doing things, the amount of compassion, because care. People think that I care for my mother. Okay, how do you care for my mother? I feed her 3 times a day. I bathe her twice, and then I give her a place to sleep nicely. Care is not that. Care is a psychological support, the emotional support, the financial support. It's not just a physical support. And you need to be feeling that you are also supported in order to give that kind of support to another person. So how can we expect this to be done on charity basis? How long can people run on a charity tank? You need to give them the right amount of pay. I'm talking about the doctors level, because their context is different. They are not salaried staff. Okay, that's why they charge. So you have to look at the contract, their contract. That is another story. But this is talking about dignified care, or even any minimum standard of care. Okay, so yes, maybe you can start with giving people training. You can start giving people certificate. In the UK, Scotland, many countries, they give caregiver allowance, parents allowance, and many things. We just have to change our mind first, how we see care, and the value of care. That if you value it, the social value punya expert ada kat sini. If you value it, you should be paying them CEO salary, right? So we have to start with that paradigm, and that's how Because we talk to businesses who provide care, we met so many of them. They are doing this out of, no one wants to be, this is the least profitable business in the world. Not profitable, but the least sustainable.
Yes, most of the
Even care clusters take 5 years if you're not wrong. That's why many of the care organizations, they cross-subsidize their property developers like Sunway, then they can open a Sunway care center. Because that itself will not be, they cross-subsidize their profits within the group. We want more choices and we want things that maybe we can pay, maybe we cannot pay, we'll figure it out through the financing. But if there's no choice, we will be forever paying at a high price and forever be paying for very little service. So whether it's sukuk, whether it's insurance, whether it's DNT, there are so many that I'm reading. There's so many more. Alhamdulillah, but we need to start by valuing it correctly. And with all externalities, valuation is a big issue, right? So they did the unpaid care valuation, they did all sorts of valuations, which I mentioned in my first round. But these are just adding to the voice that we really need to change how we value care, the value of valuing unseen. The unseen ni cerita banyak pilih topik tu macam sangat lah pula sentimental dan makin valuing unseen, because valuing, if we don't know how to value, we cannot start anywhere. We cannot start at all. We have to start at valuation. And that's right. What else? Yeah, we cannot break that issue about private sector until we have other choices to do it. Right? Until people see it as government cannot even have, government now is so burdened with the health and the education. So it's really, we have other people have to step up because that's not really going. Sukuk is some kind of social SID, right? Some kind of SID, DIP. So we'll see whether that model also works. And so Selangor has that. Selangor has, even the federal government has not issued these programs so the people right? But you really need good actuarial estimates to know how fast your budget will run out. Because you can offer that as anything you want, with just support you can launch. But if you wrongly estimate the demand, plus the burden of disease that causes aging to be poor aging. We are not aging healthily. No, we are not aging like our own parents. We are not aging, but we are probably aging with NCD. We are probably aging with dementia. We are probably aging not hospitalized. But we are having that kind of aging because we do not have enough prevention, enough awareness about how to be, how to age healthily. And how to age well. So these are the considerations also. You can slice it how many one. You're not target siapa-siapa yang ada age. Masing-masing you can slice lah. Jadi you talk to each other and then you end up not creating offsetting effects semua. Which are the CPF is doing their utmost. The support that stock so can only do up to 60, but they're supporting that also on disability, care for disabled, and so on.
Dr. Najib, any other question? Yes, Dr. Najib.
My question is because the conversation and whereby this care worker housewife and hospital and where by any other means I find that in the or is there any land guarantee or any work being done? If not, what in your opinion that value of
you, Dr. Najib, for the questions. So, in terms of real valuations of this unpaid care work, in at least in the framework of GDP, currently there is no systematic way, right, Dr. Risha? There is no systematic way of valuing or even incorporating the value of unpaid care work in our GDP calculation. Uh, so in that regards, I do believe that measures like conducting national level time use survey, for example, to look at how people spend their time and what are the value of the time that we spend either in a space of paid work or unpaid work can be a lot more clear, and this can be counted into the formal economic value activity like GDP. So previously I was working at KRI, so we have been actually promoting to the government to conduct national levels survey, time use survey, but not to that great success. Last year, I think the Department of Statistics were talking about conducting this type of survey. I am not really sure what has been the progress. Maybe some can chip in later. But so that is one part. But maybe if I can just segue the discussion on how government is trying to recognize these types of work in terms of initiatives that government have been putting in. So I think that they have been making progress, particularly from coming from the pressure from research community activists to actually try to get policy attention to value care work. But we have to do a lot more. For example, government have actually given even a very small amount care allowance to those who are taking they call this assistant for bedridden care receiver. So the caregiver will be getting this social to in a way compensate the labor that they have been provided at their own space without procuring the service from the market. So I think this is one right step to go. But I would like this year EPF were trying to push for the government to expand these types of allowance to expand beyond just a bedridden care receiver. We also want it to be extended to aged care, elder care, disability care, even for parents who are taking care of disabled children. But I think progress has been a bit restricted in that regards. But I think we have to continuously to push for this. In other regards, beyond care allowance at the other side of PPF, as mentioned just now, we have a Paraan scheme where we try to ask government to also provide matching grant for the RM1 additional contribution given by the members. The government will give about 25%, I think, right? And then we have also ISURI to recognize the contribution of homemakers, but still this is still targeted for means-tested for just poor homemakers. So we would like this to be expanded as well. And we are also trying to expand this contribution. We call this al-sayang, where the husband or those who love you can also contribute to the loved one within the family setting lah. So I think those are the things that the ways that government making minimal steps to progressively value can work, but I feel a lot more need to be done, I suppose.
Okay, just if we were to do a map of what's out there, yeah. So we have the welfare department, we can cover so much. Welfare department's work is funded by taxpayers' money. Taxpayers' money come from direct tax, indirect tax, and the rest of it, right? So I've already described the problem with direct tax, and now we have to look at alternative streams from the indirect tax. So that's how you can grow the government support networks, yeah, the government network for that. Then you have people financing care for themselves, right? So either through the retirement, the mandatory provident retirement plan, for those who are working, plus those who voluntarily register with EPF. Okay, that's where the issue of coverage is. Now, that retirement scheme, you also have private retirement scheme. You also have reverse mortgage scheme, where you can sell your house to finance your care or whatever you want in your old age. Yeah. So those are the three. And other than it's of course the pocket money and everyone you want to borrow from or ask from. So that's how people finance personally. Now, those are limited also because of the wage that we earn and because of the people to support us. They have their own families and regeneration, blah, blah, and so on. So that's private financing for care. This is government's financing for care. Now we have an option that we want to look at the third sector and even the debt market, like sukuk. Right? We're looking at the capital market. Number one, number two, number three, number four again. Number three is the third sector, all waqf and the zakat and yes, all this, everything else that comes under that. How do you want to mobilize it cleverly so that it comes into the ecosystem, right? And it goes to people who deserve it because you have your rules regarding the social finance recipients as well. Okay. Then the fourth one, which I spoke also in some of my writings, is that how do we go into capital market? How do we tap into capital market or debt market? To be able to do that, it's not impossible, provided you must show that the businesses are profitable. Or you must de-risk it in such a way that people do not hesitate to enter it. The market is very wary of something that they do not know or something or the profit level that they cannot see. So if you want to tap into that market as a complement to the others, everyone must play their role. Huh? Okay? Then you have to create that a business sector that can be affordable yet profitable so that there will be some interest from the capital. How you make green and halal attractive for the capital market, yeah, whether it's sukuk or debt market, whichever, it's the same way that you do. And it is a valid business. Okay, now you look at me like I'm a religion or something. Now we have talked to a lot of business owners. They are struggling, they are selling their house. Do you want to go into this? I asked them, no, I also don't want, but you talk about care every day. How? The reality is that they need to survive financially as well. And they need to expand. But they should be able to expand. There are a lot of success stories, no doubt. I can give a few big companies that are actually care related and they've been able to tap into the market, even got their CDA and all that. They could do that kind of thing. And the more they will be more affordable and they will be more innovative and they can meet the demands of the small get. They can spectrum. Many people, I don't know macam ni. I don't know macam ni. You know? So they have, just like baju, you can sell. Some people can sell baju, some people can sell. So the market is wide open for everybody. Just want to make sure everyone is coming in. Everyone is coming in because the demand is going to be there. That's for sure. The supply is not there. How people can pay for the supply is one thing, but is there a supply in the first place? Right? Whether the government supply, the family supply, the private insurance supply, whatever supplying it lah. The private sector supply. So which is what we are worried about. our families are smaller, and there are about, what's my number? About 13% of families, of households in the last survey, HIPS survey, where the head of the family is 65 years and above. So what's the implication of that data? You can find a lot of data you can use. If the head of the family is 65 years and above, that means that household is probably made up of only old people, whether they are staying alone or they are staying alone, just without spouse. And you already hear a lot of cases news in the newspaper about social hospitalization. I mentioned this now about old people dying alone at home, right? Here in Malaysia. So that's the reality. The demand is that we have to, if not the mother, the father, our neighbors have to do something. And which neighbor can do this for them? Yes, in an ideal, Dr. Marwa will look at me, when you know everybody in Islamic community. Yes, in Islamic community. But in a sustained way, we also need to have it, have more options and more sustainability guarantee. Which we start with them, and giving them their due needs. They shouldn't be charging exorbitantly, but at least they get their needs. This is an argument for even Islamic finance financially. You don't do Islamic finance on charity. In order to keep them in the market, you still have to pay them their right value. Isn't it? It goes the same way.
If I can just add a bit more, just to on Dr. Haniza mentioned just now about creating the supply too. So this is where I think EPF stand at a unique position now. So one side of the coin, we are social security institution that try to ensure the aging of our members, income adequacy, they have enough to buy what they want or get what they want during old age. The other side is actually the role of EPF as a fund manager, basically, because we actually are collecting contribution, and on monthly basis we are sitting on a lot of cash that we need to actually place this to generate returns, kan? So, but then I think the other equation pula, in another equation, our members expect good returns, kan? So we know that we are in this aging ecosystem. We have a fund to invest on, but then to really ensure the investment generate good returns that we can go back to the members too, is something yang as Dr. Hadiza mentioned lah, we would like to see a lot more players and then a lot of de-risk that I mentioned just now. Regulation need to come in place, strengthen, harmonize, and then market player can come in, and that's where we can entice a big institutional investor lah, who also put money in place. Cuma I do hope that the developmental role of itu kali, because I think big fund managers can afford to take a bit more risk and to wait a bit longer. So while we are trying to provide good returns, maybe priority need to also be channeled to those who can be strategic for our country development. Certainly.
So just to add a bit, because Dr. Haniza mentioned about the capital market, and I believe we have not yet fully tapped the potential of the capital market when it comes to care. Because yes, there are basically the majority of investors, they would like to look at the return, but there is also a segment of the investors where they don't look too much on the financial return, but they look at the social return. So these are the impact investors, right? Impact investors. And even if you look at our society as Malaysians, right, or Muslims, we are very charitable, right? Especially if you look at during Ramadan, ada crowdfunding dia memang bagi QR apa semua. So one is that you can structure the sukuk, or even if you are interested, social impact bonds, right, to show the value. And this is where the Tarina mentioned about the SROI. So one of the ways that you want to show the value of the social return is by measuring the social returns, so that people can see this is something that I contribute to and what is the return, right? So sometimes, yes, people will be interested to see what you call the financial value of return, but maybe people would also like to see the qualitative return. So this is where you have now the role of impact measurement, right? So SROI is part of that as well. But there are some quantitative measures where you cannot easily put a monetary value on it, right? But you have to develop that impact measurement to show. Basically, we see that this is possible, because if you look at social impact bonds, for example, social impact bonds are basically bonds that are issued, but the money is not being used for financial investment. There's no financial returns. It's just social returns. It's used for social programs, right? But people invest in it, right? And we have the example that we had the SRI sukuk, right? Khazanah SRI sukuk, whereby the money is being used to fund schools. There's no financial return for that, right? But it's still oversubscribed. And there is a mechanism to provide financial returns, right? And under that structure, there is also the way whereby the sukuk holders can forego their right on the returns by claiming on the tax, right? So we have that basically still untapped, I believe. And hopefully we can see more SRI sukuk, especially SRI link sukuk, and also link that maybe to waqf, SRI waqf, sukuk waqf. And then the next part that I want to highlight is also on, I think, ask about the government policy, because this was mentioned in the speech by the Prime Minister. I believe there's two parts of the policies that have been highlighted. Number one is rangka tindakan penuaan kebangsaan. So this is basically, I'm not sure how to translate it, maybe a national aging action, because rangka tindakan kan, tindakan is action, like actionable framework. So this will be launched next month, inshallah, and hopefully I think it will address many of the things that we are discussing today. And then the Prime Minister also announced that the government is looking at national certification framework for care, right? So they are trying to see how we can train and certify that these are properly trained people and make it into a professional work. Right? So these are some initiatives that undertaking. And I'd like to also touch upon what Dr. Vivi mentioned on the health cost, right? So because we are, there are some proposals that we move towards a more privatized health system that is covered by insurance, but there's also the danger where you see as Dr. mentioned, the manipulation, not only from the doctors, but also the medicine costs. I believe that even the minister had highlighted, whereby when the hospital knows that this person is covered by insurance, suddenly the cost of the medicine change, and even they start to charge for the mask, for the glove, for each item. There's a charge for it. So this is where again we look at the institutions in Islamic history. Another institution that we have to look into is the institution of Hisbah, right? The institution of Hisbah that takes care of all these, hanky-panky, right? So maybe then there must be a sort of a commission that looks into this, right? So we have the competition commission, maybe some commission that also looks into the healthcare as well, right? To ensure that it is, yes, you want to make it more private, but make sure it's fair, right? So don't manipulate on this as well. Yeah. So these are some additional points.
I just want to describe my experience designing a blended finance sukuk for saving tigers of all this. How long, I don't know how far it has gone because I left the end after that. So this is a global initiative to save endangered species. So it's the same thing. What they did is they have tiers, right? So the Rockefeller institution, all these WWF, all the ones with the big money and no returns expectation, but they have their outcome indicator, and we pay based on the outcome indicators. Then the second tier, they want 1% return just to make sure that they have to answer their need. So they get, and their indicators is the same or more. And then you have another tier, you have all this, because this kind of social agenda, they require patient capital. Okay, you cannot talk to the capital market like I'm talking about this. It requires patient capital. It means they have to either forego their right to financial returns and accept the indicators of social returns, or they have to wait a bit longer before it becomes profitable. Okay, so these are the people you need to get if you are looking at the market, capital market option. So you combine the third sector as well as the higher tier, they may get their money 5 years later when things really become profitable, then they can ask for your 5% or 4%. But other than that, a single sukuk just on one investor group will not look very successful at the moment. Yeah, because this is long term and you have your shareholders or your board members to answer to. Even with third sector, you still have to be answerable and make sure that you're using the money efficiently. And you're not supposed to do it yourself also. Ya, takkanlah Darul Majlis Agama dah buka dia punya rumah anak yatim ataupun ini. You have to find partners. So that means that how do you get it? How do you determine what the indicators will be satisfactory for your institution, even though you're not charging for money back, even though you're not expecting returns. So this tiered approach was a global, the World Bank approach of saving the rhino is different from saving the mother was different. So we can study that and see whether this can be used. The use of proceeds is for care, for instance, not for saving harimau. Orang muda-muda ni can do that.
Right. Subhanallah. I think we have heard quite a lot of inputs. I think even for myself, I didn't realize that it's already 12:15. Yeah, but from what we have gathered from this almost 2-hour sharing session, is that there's still lots to be done. Yeah, in terms of the care economy, in terms of awareness. Yeah, because returns not necessarily be measured through financial. Yeah, it can basically be measured through the social value, impact, and things like that. So in terms of strengthening the ecosystem, it's still a lot of things needs to be done. So that's also the reason why INCEIF University is partnering or collaborating with Selangor, Wanita Berdaya Selangor as well, so that we'll be able to actually tap into the data and working together on activities, particularly on care economy, because that is the only state that have actually introduced the policy on care economy. So I suppose the concept of de-risks, and valuing correctly in terms of the unseen care economy is also very, very essential. So we'll be able to basically provide the right care at the right place, at the right time, and also at the right price. Yeah. So with that, I think I thank each and every one of our panel, Dr. Haniza, Madam Hawati, and also Dr. Said Marwan. Thank you so much for your very insightful sharing. And I thank each and every one of you who have been very attentive in listening. So inshallah, may all of the benefits, basically we'll be able to actually obtain that. So wabillahi taufiq wal hidayah, I pass the session back to the
Our dear panelists and moderator for that very engaging session. I'm sure you guys are feeling a bit tired, perhaps a bit hungry as well. So as usual, at the end of every event that we have, we do have some makan-makan at the end. So please, I would like to invite our guests today, including our dear panelists and moderator, over to the banquet hall for some lunch and refreshments. With that, thank you once again. Assalamualaikum warahmatullahi wabarakatuh. See you in the next event.